Hi, I'm Paris, and I heard the sad news this morning that Toby Keith passed away. If you don't know who that is, he's a country singer and he has some amazingly good songs. I'll link to a couple of them down below this video. My favorite of all time is a song about getting older called "I Ain't As Good As I Once Was, But I'm As Good Once As I Ever Was." I think that song was the guilty pleasure of quite a few men getting older. It's the kind of song in the car you turn the volume up, put the window down, and sing it as loud as you can. I know I often did that. Toby Keith died at 62 of stomach cancer. He went through the whole chemo and the radiation, and I hadn't heard much lately, so I was hoping he was improving and that there'd be another album, maybe with songs that were poignant yet humorous about going through this as one of life's experiences, but it wasn't to be. So I was sad to hear the news, but also shocked. He was 62. I'm 60. He got his cancer diagnosis he announced it about a year and a half ago. I'm thinking he probably got diagnosed with cancer within a year of when I got diagnosed with prostate cancer. So I kind of saw our paths going along once I learned that he had cancer. And so it's one of those things that when you have cancer, when you see an article in your news feed about somebody else like Prince Charles, I think that was just announced today. I think he has cancer, but I don't think they mentioned what type. You read the story. 5 or 10 years ago, I'd have scrolled right by. But now I read those stories, and of course you're trying to find some semblance of order in your own life, and by seeing other people who are dealing with the same thing, you try to incorporate what you can learn from that experience. And with Toby Keith's experience, it's just kind of worrisome because here's a guy who was, of course, being famous doesn't do anything to help your health, but having the money to get, you would think, the best care, the best doctors, the clinical trials and so forth. And as a fellow cancer fighter, you think, well, gee, with all that, and he passed away in just a couple years, what chance do I have? I guess it may be more like what the band Kansas says in their song "Dust in the Wind," all your money won't another minute buy. And speaking of cancer and anxiety, my last thing of cancer treatment, because I did the chemo, did the radiation, and then 3 years on Lupron, which is androgen deprivation therapy. In other words, no testosterone. I had my last Lupron shot last August, a 3-month shot. So if I had continued the treatment, I would have gotten a shot in November, but they said, all right, we're going to discontinue this and see how your numbers look. Well, it takes a while for the testosterone to get going again, but they wanted to see me 3 months after that point, and so that will be next week. Now, there's this psychological phenomenon. It's for various ailments, but you'll often see it mentioned in a connection with cancer. It's called Scanxiety, which is the anxiety you get before going for a scan, because it's hard enough getting the news initially, you have cancer, but then after the treatments and they're going to see how it worked, then do you have to go through hearing the news, oh, the cancer is back, or you still have cancer, or we don't see any cancer right now, but it's always right now. It's only after you get 5 years or more past them seeing any signs of cancer will they use another C word that people are afraid to bring up with cancer, which is cured. So the best news you can reasonably hope to hear is there's no sign of cancer right now. It still leaves you with anxiety. Of course, it's better than hearing, oh yeah, we can still see cancer activity. There's more anxiety, there's less anxiety, but I think there's probably never again going to be no anxiety. Now, I did go through this after finishing 4.5 months of chemo. As miserable as chemo is, you feel like you're really doing something. You're there at the doctor's office every week or two, sometimes even more often. And hopefully you're fortunate enough to see improvements. The numbers are getting better, the tumor is shrinking. All of those things are great to hear, and you're there fighting it by suffering through this treatment. But then when the treatment ends, rather than wanting to ring a bell and have everyone cheer that, yay, the chemo's done, it's okay, what are we doing now? Let's not rest on our laurels. We need to get on with the next thing. So I went through that with finishing the chemo and kind of with finishing the radiation as well. But now 3 years of having no testosterone to kind of starve out the cancer, and that works in conjunction with those other treatments. But this appointment next week is the beginning of finding out did all that treatment do the job, so that at least I can have some appointments in a row where they say, we don't see any cancer for now. In my case, because of the course of treatments I had, that's going to be a little more confusing than for a lot of prostate cancer patients who had surgery and had the prostate removed. Because I still have what's left of my prostate after the chemo attacked the cancer in it, and then they radiated it day after day. So whatever's left, there's still some prostate there. So for people who've had their prostate removed, it's pretty clear the numbers they're looking for, and that's 0. You don't want to see any PSA. In my case, it's going to be a lot harder to tell because my PSA numbers should start going up. And I'm thinking it could actually get back up into the healthy range. I'm not sure of how much prostate I have left, but it could get back up in that range. And so long as it gets that high, healthy range, levels off and stays at that, then that's what's going to be considered a win for me. This means months, maybe even a year or 2, as my testosterone slowly comes back up, the prostate gets going again, the PSA numbers will come up and they will go up, but is it a normal thing happening or is it a worrisome thing happening? So I've got the next year or so of going in for my tests and seeing that and wondering what it all means. It should come up to normal levels and then hopefully level off and stay there. Of course, the worst thing would be to see the numbers shoot up really fast, go past normal, keep going up. That would mean that all the treatments I had did not do the trick. So again, getting test results, there's high anxiety, low anxiety, never going to be no anxiety. So if you have someone in your life, a friend, family member who's going through cancer and they go through the rough treatments, but then they improve, they look better, their test results are better, and you think they're getting right back on with life, but then they do something weird, something that doesn't really seem like them. It may be that after all that time with having high anxiety, low anxiety, but always some anxiety, sometimes you just want to be able to clear your mind so you don't have to think about it for a while. So you may even do things that turn your life upside down, throw yourself into things that you had no interest in before, just something that you can get your focus on to quiet down all those other voices and have a little bit of peace. So judge us not too harshly. It may not make sense to you what we're doing, but somehow makes sense to us. And as for Toby Keith, give his songs a listen, even if you don't know who he was and you don't like country music. Some really good songs worth listening to. I'll link to my favorites at the end of this video and down below. And I'm going to say a little prayer, and I'll see you on the next review.
There are so many choices and you don't want to stress. You want your health food at home, receiving only the best. That's what we're here for, we give honest reviews. Paris TX.